lunch symposium นะครับผม Okay, for the next half hour is the lunch symposium. This lunch symposium is supported by Upright Simulation Company Limited. Thank you again for sponsor. Today is our great pleasure to receive the lecture from Dr. Ryan Rivera. Dr. Ryan Rivera, he is now the clinical assistant professor at Stanford School of Medicine. Additionally, he is the current CEO and co-founder at SimX VR. SimX VR is the world's leader company of virtual and augmented reality in medical education. Today, Dr. Ryan Rivera will give us the lecture in the topic of VR virtual patient encounters, the future of simulated medical training.
All right. Well, thanks so much for that introduction. I'm going to go ahead and share my screen so we can get started. So as you said, today we're going to be talking about VR patient encounters, the future of medical training. And, before we talk about the future of medical training, I think we have to start a little bit by talking about the past. So if you were a doctor or a nurse or an EMT training 50 or 70 years ago, then you would have spent the first couple years of your training in the classroom. You would have spent just a very short amount of time on simulation, but you would have gotten most of your actual training on real patients. Now, fast forward to the present day, and what do we see? Well, we still spend a couple years in the classroom, and it's true we just do a little bit of simulation training, and it's also true, actually, that we still get most of our actual training on real patients. Now, this is kind of shocking when you think about it. We have supercomputers in our pockets. We have self-driving cars on the streets. We have robots doing backflips. Technology has advanced in so many ways, but when it comes to training people who save lives, we're still doing things the same way we've been doing them for almost 100 years. And it's even more concerning when you realize the scale of the problem we are dealing with. So these are data from the United States, where you can see that due to preventable hospital errors, we have almost 50 deaths every hour. Right? Now, this was the problem that vexed me. Before I started SimX, I worked in quality improvement and patient safety for government agencies in the United States. And I became inspired by the airline industry, which has developed a fantastic reputation for safety. And a big part of how they have done that is through a high volume of very high quality simulation. And both of those things are important. You have to do a lot of it, and it has to be realistic. That picture on the left is a simulated cockpit. Right? That's not the real thing. That's how realistic their simulators are. But you all know, I'm sure, that when we do simulation in healthcare, we don't have that level of realism. We have these, right? Mannequins that can't really show traumatic injuries. They can't even have rashes. They can't have neurologic symptoms. They can't sit up and cry on your shoulder. There's a lot lacking when it comes to realism. But the larger problem, I think, is actually that they are very, very expensive robots that you have to put on a real hospital bed, and you have to build a fake hospital room around them in order to practice your training. And this is very resource intensive. And so very few institutions are able to sim as much as they would like to. And so these are the two problems we set out to solve through virtual reality, because in virtual reality, there's so much flexibility in what you can portray. We'll go here. Your patient can be a baby or a grandmother. They can be vomiting. They can be missing limbs. You can be in the PACU one moment, and then you're in the OR, and then in the next you're in the emergency department. So much flexibility in what you can portray just with virtual content. And then, secondly, the fact that you can set this up anytime, anywhere. So this is the US military using our product just in an empty hangar. And they've got one team doing a mass casualty one team, pulling someone out of burning wreckage, another team in a helicopter, all set up in just a few minutes with equipment that you can carry in a single backpack. A couple other reasons why I think XR is really starting to take off. The fact that you can track performance with minute precision. So not only can we tell whether someone's given the right medication or not, you can even tell whether they're looking their patient in the eyes. You can tell how quickly they started antibiotics on their septic patient. And that can be tracked within the system rather than in traditional means where the instructor needs to be watching carefully and taking notes throughout the encounter. And then the final reason I think to care about XR and virtual training is the fact that the evidence really supports it. We've now got over 4,000 studies in the medical literature on VR in healthcare, and the large majority of them show that it improves outcomes compared to traditional methods. So let's talk a little bit about the definitions, because I think in order for us to be able to be educated in how we use these technologies, we need to understand what they are. So we'll go through virtual reality, augmented reality, mixed reality. We'll talk a little bit about the use cases in each of these spaces, and then we'll talk about what's coming next in the future. So all of you listening here can be ready not just for what's out there now, but what's coming next. So when we're talking about virtual reality, we're talking about that picture there on the left. You are completely enveloped in the virtual world. That's what we're going to show you in a demo here today. This is a little bit distinct from augmented or mixed reality, and these two can get a little bit confusing. But augmented reality, as you see in this picture in the middle, is where the real world is the star of the show. The real world is what you're looking at, and the virtual content is just there to augment it. And then finally, you have mixed reality, where these two things are intertwined, where the virtual content and the real world content are interacting together. And again, we'll talk a little bit about each of these in sequence. You may have also heard the term XR, short for extended reality. And that term just is referencing everything in this space, whether VR, AR, or mixed reality, any combination of the real world and virtual content. So starting first with virtual reality, I think this is the modality of XR that has developed the soonest, the fastest. In the early days, we would see examples like you have here in the upper left, people using virtual reality glasses on pre-existing surgical trainers. Now, I'm speaking to surgeons, so I don't have to tell you that while this is probably fun, it's not actually very useful. If you're doing a laparoscopic surgery, you're not actually looking around inside of their abdomen, you're looking at a screen. And so this is an example where VR actually takes away from the realism of training. And I bring this up only because this happens often with new technologies. The very first few iterations are things that are added because it's fun and it's exciting, but does it really add value? And I think this is what we all need to think about as educators, making sure that we're applying this technology in ways that truly add educational value. Other use cases here actually do add value. Using it for anatomy training, where you really can kind of get under there, peel back the muscle tissue, look at the connections of the ligaments. You can see the way that the vessels run underneath other anatomical features, and that's a situation where VR I think does add value. Or here in the upper right, people are sometimes using 360 video in VR to learn new surgical procedures. So again, as you know, sometimes if a new procedure is being popularized, really the only way to learn it as an experienced surgeon is to go visit a hospital where it's being performed and learn from them in person. Well, if you can instead put a 360 camera inside that OR and put on a headset, you can have the experience as if you are there and be able to transfer knowledge much more quickly. Here in the bottom, we see various iterations of kind of what we do at SimX, using VR for virtual patient encounters, being able to have a conversation with a virtual patient, use your stethoscope, your ultrasound, make some diagnoses, apply your treatments, and practice your skills in a safe environment. One final use case for VR that I think is really fascinating and is up and coming is using it for empathy training. So being able to experience life from the perspective of your patients. This is an example of that where you see what it's like to have cataracts. But this same company makes one where you experience what it is like to be schizophrenic. And these use cases, VR is very unique in being able to put you inside of somebody else's body in a way and helps you understand what their life is like. So this is, I think, another very unique, interesting use case that we're going to see more from in the future. Talking next about augmented reality. And this is one that is still in development. I think there's a lot of opportunity here, but not a lot that is out in the wild. So in the upper right, you see examples from the manufacturing industry where people have used augmented reality to show you in this moment, you should undo this screw, you should open this flap, you should cut this wire. Some people have theorized that you could use this in surgical contexts, and you see kind of a prototype of that in the bottom right. Now this is, as you can imagine, still pretty complicated. A human body is much more heterogeneous. It's much more varied than what you would see in machinery. And so we're still working on the visual identification technology to make this a reality. This is a little further away, but I think will be an exciting use case in the future. And then finally, mixed reality. And so these are, remember, circumstances where the real world and the virtual world are intermixed. And so there's a number of examples here on the market now, tools that let you look over a pregnant patient and see the fetus and the station as it advances through delivery, tools that let you use just a plastic ultrasound probe and put it on an empty mannequin and practice your ultrasound skills. And the mixed reality tools actually generates the ultrasound content as if it were a patient with organs. And tools like you see in the bottom right, where you can make a virtual patient appear in front of you in a real world environment and use your real world tools to interact. Now, as exciting as this is, I think there's a lot more coming down the pipeline that all of you as future innovators should be aware of. Things like wireless headsets. Now, this is not really so new now, but I think it's worth noting that if you want to get into this space, wireless headsets are the future. There's not really any place for buying wired headsets now. And part of that is because room scale locomotion is so much better than other ways of moving around in VR. This is walking around in the real world. And this is what you'll see in our demo today, or if you were to go to the booth. When you're walking around inside of VR, instead of using your joysticks, motion sickness is reduced to almost zero. And this is historically been one of the big barriers in VR. But if you use wireless headsets and room scale, then that mostly is not a thing anymore. A couple other interesting advancements coming down the pipeline, using cloud computing to get higher and higher quality graphics on smaller and smaller devices. This is done in the gaming world now, where you can sign up for services that will beam very high quality games, even down to just your cell phone. And the processing is done in the cloud so that your phone doesn't have to do it. This technology is being applied to headsets in VR so that you can have very high quality graphical experiences, even in very rudimentary and low cost headsets. Hand tracking is coming very soon. Most of the headset manufacturers are experimenting with this right now. And this is going to allow us to abandon controllers entirely and be able to model out more complex procedures successfully in VR. Advancements in being able to measure people's performance. I talked already about how VR already gives you a lot of advantages in measuring performance compared to traditional tools. But headsets are increasingly building in eye tracking that will let you see exactly where your student is looking at all times. So you can know when they first recognize those abnormal vitals. And also things like biometric sensors, so you can measure their physiologic stress levels while they're in their simulation, and you can tailor your simulation to your student to keep them just stressed enough, but not so stressed that they're not going to remember what they're learning. This is really exciting to me because now we're training medical providers like we train Olympic athletes, measuring their output and keeping them in the sweet spot at all times. And this is going to help us train people better and faster. Something else that's coming soon is mixed reality through VR pass-through glasses. You may have seen this in the Apple Vision Pro or in the more recently released Quest 3. This lets you have mixed reality experiences through VR headsets. It solves a lot of the problems of previous technologies and is going to help us advance mixed reality much more quickly. And then a couple other quick things coming our way. Volumetric cameras that will let us take 3D pictures of real world environments very quickly so we can replicate them in VR. Tools that will let you smell virtual content, which might seem a little trivial, but I think we all know that there are certain conditions like necrotizing fasciitis that have a certain smell to them, and being able to replicate that in VR can be very helpful. Or haptics. Now, this is unfortunately still a little ways away. It's pretty challenging to make the detailed pneumatics that you would need to really be able to feel a scalpel cutting the skin. But I have confidence this will come eventually. And when you have this, you'll really have kind of the gold standard of simulation, being able to create any content you'd like with virtual reality and be able to have the tactile fidelity needed to train procedures as well. But what else is coming down the pipeline? Well, that's for all of you to help us figure out. And this is maybe a little bit of a cheesy way to end here. But I think if you're at a conference like this, at a time like this, then you probably will be the innovators in XR in the future. We were the first to bring this to the market, and that was only 7 or 8 years ago. And so we're really standing at the very beginning of how this technology will be used. So I've given you some of my thoughts about where I think things will go in the next maybe 5 years. But beyond that, I think it's very hard to predict. And it will be people like you who are coming to conferences like this who will be doing the next stage of innovation with this technology. So thanks so much for your time. I think we're going to hop into a quick demo here and show you what this looks like in real life. I'll stop this sharing and pop into the next.
While Dr. Ryan is changing over, I will introduce myself from the Netherlands. I'm participant number 1 in the scenario, Martijn from the Netherlands. And Oei, you are somewhere, but you are physically nearby, but you are joining me in the scenario in a second.
Yes.
Dr. Ryan, one thing, there will be no translation, so we'll do it all in English.
That's
perfect.
Fine.
So I'm going to hop in also.
All right. So, and I will be running this scenario from California. So this is one of the wonderful things about virtual reality is it lets us all train together no matter where you are located. And so what you're seeing here is my screen as the instructor. So this is what gives me the ability to control the scenario as it goes along. And you'll see Martijn, the green player here. I'm in the scenario. I can see from his perspective, or I can go out and just take a look at the entire room so I can keep track of what's happening. Our red player has joined, and I can switch to their perspective if I'd like, so I can keep track as the instructor of how they're doing, even if I'm not wearing a VR headset. All right, well, the red player is getting themselves situated. I think we will go ahead and start this scenario. Okay. Now, let's see. I'm not sure if my audio will come through while we do this. But why don't we start, as we start with every scenario, by talking to our patients. So, green player, why don't you ask the patient a couple questions?
Sure. I'll be with you in a second. I'm just washing my hands. I'm going to join you. Okay. Here we go.
That's gloving up. Excellent.
I am Martijn. What is your name? How are you doing?
I'm Jason Smith.
Great, Jason. So what are you here for today?
I was out jogging today, as usual. And about 10 minutes into my run, my chest started to hurt and I felt out of breath.
Okay, is it still hurting right now, your chest?
It hurts on the left side.
Okay.
Pretty bad, like a 10 out of 10.
Well, I'm sorry, Jason. We're going to help you. I'm going to take off your gown. Is that okay for you?
Thanks.
Yeah, perfect. Oei, would you please connect the patient to the vital sign monitoring? So
now what you'll see is that they're able to do everything just like they would in real life. So they're able to grab the cardiac leads, place them on the patient, the blood pressure cuff. If they were to grab a stethoscope, they could listen at all of the usual locations for the various heart valves. They can ultrasound this patient. They can even place orders via the EMR and have those return to their EMR tablet. So there, we'll take a listen. Lungs sound pretty clear to me. I don't know how well this is coming through to you all, but we can hear the heart sounds at each of these various fields.
Bit tachycardic. Okay. Could I have the...
They're doing pretty well, so don't tell them, but I'm going to make this patient get a little sicker.
Could you get me the tablet, please?
All right, so you can see the oxygen levels are starting to drop. So probably red player, it might be good to hook this patient up to oxygen while the green player is placing some orders. So far, we don't have too much information. We just know that he's having chest pain, and it's pretty bad. It's 10 out of 10. It's on the left side. Could be anything, really, at this stage. But they're going to order a few labs to get things going. And you can see, I can tell here on the instructor module which labs they've ordered. Looks like a D-dimer. They successfully placed this patient on a monitor. If I'd like, I can help them out by ordering a few things that they might have forgotten. They ordered an EKG and it's already returned, so they can take a quick look right there. If they were to order a chest x-ray or a CT scan, that would also return to this EMR. Now, I'm gonna jump things ahead even a little bit further.
I'm really scared, doctor.
Well, we're still
telling you, they're feeling pretty bad.
I think we're going to give him some medicine, but okay, something's going wrong. Let's prepare for intubation. Let's put the bed back, please.
The patient has become a bit less responsive. Has anyone checked pulses? Now, if they feel pulses, they can feel the vibration of the pulse in each of their pulse points. But in this case, they don't feel it. So they're correctly starting compressions.
Okay,
and
nurse, could you start compressions? Thank you.
So they've
starting CPR.
So they've asked the nurse to start compressions. They're placing them on the defibrillator. They've got their code cart. They're giving a dose of epinephrine, it looks like, and the system is tracking all of this. You can see down here in the bottom left the different directions this case can go depending on which choices they make. And this case,
clear.
We'll have
Stopping CPR.
Okay, they shock the patient.
Okay. Time 37:21. Restart.
Okay, she's restarting compressions.
Okay, give the epinephrine.
Now, it looks like this patient is in PEA.
Could you bag the patient? I will do that, actually.
Okay. Now, in many cases, things like intubation, bagging the patient, chest compressions can be done either by a real player character or by an NPC. So you can do this as a mega code with your doctor, your nurse, your tech, your respiratory therapist, all working together in the same virtual scenario, or you can do it with just a single provider.
Okay, we're assuming 2 minutes. Clear?
Stopping CPR.
And remember, I'm not a doctor.
It's true. This team's doing phenomenally, considering the complete lack of medical background, as far as I'm aware.
CPR.
He still doesn't have a pulse.
Let's remember that this patient had some labs. Perhaps we should check how that panned out. Meanwhile, they've done such a good job. I'm going to push them through a little bit.
Okay, stop chest compressions.
Okay.
Stopping CPR.
Yeah, got a pulse.
Okay, so they've got a pulse. The case is still not fully solved, but if we were to look at the labs, we'd see that they have a very elevated D-dimer. This patient probably has a pulmonary embolism, needs TPA, some heparin, and to go from there.
Right. Could you put an IV line in, please?
All right.
And
while they're doing that, why don't you actually call this patient for admission? So we've got somebody with a massive PE. They've just got ROS. They'll need to go to the ICU.
Could I have the admission department, nursing department?
Mm-hmm. All right.
So this ICU. Hi, Dr. Nichols. This is Martijn Boosman, room 7. I've got Jason Smith here. He has got a massive heart attack. He's back online. We are going to give him some heparin, I think I just heard. He's on heart rate of 118, blood pressure 82/59, and a SAT of only 86. I think we forgot to connect the oxygen.
Yes, well, so excellent. Considering no medical background, you already gave the vital signs. I have a number of other questions I could ask.
What medications has he gotten? What do the labs look like?
But I won't drill them too hard right now. I will just say,
Good work.
all right, they'll come and accept the patient. Round of applause for our medical team who has saved a virtual life here. And hopefully that gives you some sense of how this system works and really the power of being able to run virtual reality scenarios with a team even when they're located across the world from each other, something that would be virtually impossible with traditional training. And again, with the flexibility to create an emergency department complete with a code cart and intubation tools here in their office, right? That kind of flexibility to integrate simulation anytime, anywhere is something that we hope is going to help us do more sim, make better doctors and nurses, and therefore save more lives. So thanks everybody for your time. If you'd like to learn more, please visit the booth where you can try this for yourself. And I'm sure the team there will be happy to answer any of your questions.
Thank you so much for your wonderful lecture and of course for your fantastic role play of Mega Code across the world. So we can sure that we can study not only in the classroom, right? And we can study across the world. Thank you so much for your kind presentation today. Thank you so much.
Thanks so much for having me.
ครับแล้วก็เดี๋ยวอีกครึ่งชั่วโมงถัดไปนะครับเชิญทานอาหารนะครับผมก็รับคูปองรับประทานอาหารได้ถ้ามีคูปองรับประทานอาหารนะครับเชิญรับประทานอาหารที่ด้านหน้านะครับผมแล้วเดี๋ยวเรากลับมาเจอกันอีกทีตอนบ่ายโมง15 นาทีนะครับบ่ายโมง15 นาทีนะครับก็